this day and age, um, the technology, there are so many options, and like you always say, what works for one person may not always work for another.
Right.
So you need a different opinion. Oh,
Yep.
we are live. Hello, everyone. Happy Wednesday morning. A little snow out there on the ground.
Not thrilled.
We're kind of getting used to that white stuff, though. Thank you so much for tuning in. I'm Kim Martin, host of Healthy You. And, you know, I'm really getting excited about this show because every week we've been bringing on local, amazing experts, people who know what they're talking about based on their education and their experience and what they do. And we want to provide you and share that information and get it to you to help inform you and help you live a better, healthier life and learn the options that are available to you. So today, I'm super excited. It's the first Wednesday of February.
Right.
So
Happy February.
So Dr. Christy Durbin. Hey, Dr. Christy.
Hey.
Welcome to the show.
Thank you.
You will always find Dr. Christy here on the first Wednesday of every month.
Right.
This is your day.
Yes, a good way to start the month, right?
It is, that's right. And Dr. Christy and her husband, Dr. Sean, own Synergy Healthcare and Sports Complex over in East Peoria.
Right.
And you guys do so much over there. We'd have to do a show every week for a year to kind of talk about all the things that you have going on. Because, I mean, my daughter plays volleyball over there on Monday and Wednesday nights.
A lot going on.
A lot going on. But you know what? Today we are going to really focus on pain because there's one thing I know, and that is if you're in pain, it's debilitating. It's keeping you from doing the things that you love to do, and that is sad, really.
Right.
That breaks my heart.
Right. We have a lot of people that come into our office that have been in pain for so long that they don't even have a life anymore.
Right.
You know, it's kind of like they don't feel like getting off the couch anymore. They don't feel like doing their normal daily activities anymore. And sometimes it starts so gradually with them that they don't even recognize it in themselves. Like maybe they used to play, you know, maybe they used to go golfing all the time. Well, it starts out where they have a little ache and pain or whatever, so they decide maybe they'll just golf once a week instead of every day.
Right.
And then it gets to the point where they golf once a month maybe. Well, then that aggravates them. So then they're not golfing at all anymore.
No activity.
But then along with the golf, they've noticed that going up and down the stairs bothers them, or, you know, gardening or whatever their activities are. It seems like they just start to decrease and decrease and decrease those activities. And with that, their whole life decreases. I mean, it's not just that they're not active and not as healthy, but really their life decreases, you know, exponentially every time they cut out something that they love. And oftentimes they can't play with their grandkids anymore or their own kids. They don't feel like playing with their own kids anymore.
Energy.
You know, just exactly.
It zaps your energy completely.
Exactly. And so when someone comes into us for that, we really try to get to like the root of what's causing that problem and then offer up as many solutions as we can, because you know, what works for one person might not work for another person. And so we put together a plan of attack. And we're like, okay, let's try this for a couple of weeks. If this doesn't work, then we'll move on and we'll add a therapy. We'll add something different in order to reach those goals and to get them, you know, feeling better. But we do chiropractic in our office. That's one of the main things that we look at whenever people come in for pain. But along with chiropractic care, we can add to it different therapies. We can add to it acupuncture. We can add to it trigger point injections for the musculature. We can add to it joint injections if it's a joint pain. So really, we cover the whole gamut of pain relief in one office.
Right, because you guys have a physician assistant,
right,
a nurse practitioner.
Yeah, we have chiropractic and medical all under one facility. So we have all those options that we can use to kind of figure out what's going on with that person and really find a solution for that person, that individual.
Right. And so if you're watching and you're in pain, you got to keep watching, because we are going to be talking about some options for you. We are going to be talking about different ways that you can think about trying to help get you out of pain. And so also, if you know someone who is suffering from pain right now, would you share this show with them? If you're watching later, you can share onto your page. You can post a comment with any questions. Dr. Christy and I will come back and answer those questions. We can't see them right now, but we will answer the questions. Sure. And of course, if you're watching, show us some love. I love seeing those hearts go across. It makes us feel good, lets us know that you are watching, that you've tuned in, and we love seeing that, and we really, really do appreciate that a lot. So let's just start. The first issue, and we were talking about this as the show was going live, and what I hear a lot of times from my Curves members is they go, well, my doctor said this, I've tried this, they're still in pain, but they're only getting information from one resource.
Right.
So you need a second opinion.
Right, or even just a different way of looking at the same problem. We have a lot of people come in, and whether they've just been to a medical provider, or whether they've been to a physical therapist, or whether they've been to other chiropractors in the area, it's just, if they're not getting the result that they need and they should have, then they need to find someone else that will look at it in a different way.
Right.
All of us chiropractors, we're not all the same,
right.
and
just
all
like
the
trainers aren't all,
right.
everybody's
and dentists,
different.
Just like we were talking, dentists are all different.
I gotta go to the dentist this morning.
Everybody's different in the way that they, not only in the way that they treat people, but also in the way that they look at what the problem is. So I might have a different way of looking at x-rays than my colleague. She might look at it in a different way. And so finding a solution for those people is really just about continuing to search and to look for what the cause of the problem is, and just to get a fresh set of eyes on it, and maybe a different opinion, other than what they're currently doing.
Yeah, if your doctor has said to you there's nothing more they can do for you, you're going to be in this pain, you can get these cortisol injections or whatever, that's not true. I just want to encourage you to say there's always something. Do not give up. Do not accept the fact that you have to be in pain, because there are options.
I went through that myself.
Really?
When I was 15, I had migraine headaches almost every day.
Yeah.
They had escalated. If I didn't have a migraine, I had a sinus headache. I was going home from school almost every day. I was miserable. And I had went to my regular MD. I had went to an allergist. I had went to an eye doctor. They gave me glasses. I went to a dentist. They gave me a mouth guard. I had diabetes testing done. I had an MRI. I had CAT scans. I had a brainwave study done. I went to a neurologist. Finally, the neurologist put me on Darvocet and amitriptyline. I was 15.
At 15 years old.
I was a zombie.
I
mean, like an absolute zombie. I've fallen asleep in class, and I was still getting the headaches. That's the kicker. I was taking the medication. I was doing everything I was supposed to do, and I was still getting the headaches. So I lived in a real small town, and everybody knows everybody.
Right.
A neighbor lady called my mom and said, well, have you taken her to a chiropractor? My friend's son has migraines. He goes to a chiropractor for that. My mom's like, sure enough, we'll go. So we drove 45 minutes to the closest chiropractor. Like I said, small town.
Right.
No one around. So we drove to the closest chiropractor, and, he put up my x-rays, and he said, well, right here's your problem. And I said, what? Like everybody had said, you're just going to have to live with it. There's no hope.
Right.
You're just going to have to, deal with it. Or there's nothing wrong. I got both of those things.
People will start to say you're making it up. They think you're crazy.
Nothing.
There's nothing wrong.
There's nothing there. So for him to put up my x-rays and look at it in a different way, because he had a different way of looking at it, he not only validated what I was going through.
Right.
Like, there's a reason for this.
You're not crazy.
You're not crazy. There's a reason. And he also said, we can help you. So he provided me with that validation and that hope that there was something that could be done.
Yes.
And I'm telling you, after 3 months, headache-free, pain-free, no
And
problems
isn't it
with
ironic
migraines.
that you became a chiropractor?
And I said, I was led to this profession for a reason.
And
you know,
isn't that great? Because you knew that you wanted to help people.
Right.
This doctor had helped you, and that was such
I thought-
the same story. My daughter ended up in the emergency room because she had mono and strep and tonsillitis, and she's decided that she wants to be an ER nurse
Sure.
because this nurse took such great care of her and helped her
Impacted.
feel better, and she
Yes.
thought she was dying.
Yes.
She really did. And so this nurse just cared for
Yes.
her, and so now that
it
it's
changes your
amazing.
life. It changes your path. You know, like
totally does.
Before that, I thought I was going to be either a lawyer or a psychologist or whatever. And it's like, nope, this is where I'm going. You know, this is what I'm going to do.
I love that story.
Yeah.
Those are the kind of stories that fire me up. And
Well, it's exciting. And then when I have people that come in, I mean, because so many times we are like the last hope, you know, the last resort. And so, you know, because they have been through the gamut of everything.
Right.
But I look at that patient and I'm like, I understand. I was right where you are, you know, like I
Right.
was right there. I know what that feels like, that desperation and that there's nothing that can be done and I'm going to have to live like this. You know, I get that feeling. And so when I can take someone's x-rays and look at them and say, you have nerve irritation in this area, this is where it's coming from. If we can address that area and get that area functioning better, the nerve's going to function better. Then you're going to have less symptoms and then you're going to feel better. You know,
Right.
it all makes sense. It's so scientifically based that if you remove nerve irritation, you know, if you remove that nerve irritation, your body's going to function better.
well, it's the nerve that causes the pain.
Yeah, exactly.
Right?
Yeah,
And
you
so
just seek that out.
Yeah. So it's because it's inflammation pressing on the nerve somewhere that's causing,
Right.
if it's muscular,
Yeah.
that's causing the pain.
Right.
Because it's the nerves that's in the pain
The
trigger.
nerve controls everything in your body.
Yeah. It makes perfect sense. Well, let's just overcome one little obstacle because I can't tell you. I work with women all the time.
Right,
You know this, and so I'll say, oh my gosh, you should, because I'm constantly telling the ladies they should come to Synergy, especially if they have joint pain or they've
Yeah.
been told that they need a knee replacement
yeah.
because stem cell therapy is just. I'm like. So excited.
Right.
I'm like,
So I know.
I want to be able to do it. I won't be able to, but I just think it's so cool.
It is
And
exciting.
it's exciting. But so many people go, oh, I will not go to a chiropractor. And I think to myself, well, what the heck?
Why not? Yeah.
You're going through all this pain. You've resorted to listening to one doctor. One doctor that you think is the end all be all that says that you're just doomed for pain.
Right.
And because you've heard some type of a rumor or you may know someone who's shared a bad experience because maybe they did have a bad experience because nobody's perfect. Every human makes mistakes and there could be a bad doctor out there somewhere. You've resorted to say, I'm never going to do that. What would you say to those people?
I would tell them to have an open mind. Come in, meet with me. If they're not comfortable, we're not going to have them do anything they're not comfortable doing. But chiropractic has changed a lot in the last 100 years. You know, like we have different techniques that we can do where there's no popping or cracking or twisting. We have very gentle techniques that we use on newborns all the way up until, I mean, my oldest patient was 95, you know, so it runs the whole gamut of ages and no matter how good or bad your health is, you know, we can help those people. But when someone doesn't want to come in because they've heard bad stories, I get that. There are good and bad in every profession. There are, you know, like we were talking, there's bad dentists, bad doctors, bad whatever, you know.
Everything and everywhere,
right,
somewhere.
Yeah. But in my office, I sit down with that patient and I get a history first because I want to really find out what's going on with them. And I do a real thorough consultation. I want them to just tell me all about it. So that's the first thing that maybe is a little bit different. We're not quick. I really want to know what's going on.
Right.
And so then we do an exam and we do x-ray. We don't treat the patient on that first day. I'm like, let me look at your exam, let me look at your x-ray, let me put that information together, and then I present it to them the next day in. So they come back in for a report of findings is what we call it. again, I sit down with them in the office. I pull up their x-rays. I go through not only where they're having an issue, not only their pain level, but we go through their whole spine, all of their x-rays, so that they can see, your pelvis is kind of like your foundation. If that's rotated or not straight, it's going to make other areas of your spine not straight.
Right.
Or biomechanically, you're going to be altering your movements because things aren't lined
You're
up
out of
properly.
whack.
Yeah,
I can tell when my
things
running
aren't lined
buddy
up.
Courtney needs to go. I'm like, you need to go see your chiropractor. You're crooked.
Yeah,
like
and
she's
they start-
literally running crooked. She's like, my hip's killing me. I'm like, that's because
Yes.
it's sitting 2 inches lower than your other side. You need
Exactly.
an adjustment.
Exactly. And so everywhere that your body has shifted or compensated for its positioning, you have irritation there, whether it's to the muscle or the nerve.
Right.
You'll have some irritation. You'll have some tightness. You'll have irritation to that area. And so I show the patient exactly what's going on. And I'm telling you, 10 times out of 10, they can look at their x-rays and they can see what's going on.
You can see it.
You
You
can
can
see it.
absolutely see it.
And I have a little model and I show them, and I have a nerve chart and I show them, and they get it.
Yeah.
So then I think once they get it, that instills confidence in them to get treated by me.
And we understand, because if you have been struggling with pain, I know my mother-in-law, she's been coming in and she has been dealing with this pain for years, and she's fearful, of things, because she hurts. She hurts, and she doesn't want it to get worse.
She doesn't want to hurt worse.
And so, it's hard. And so we're not trying to downplay what you may be going through. I want you to not give up finding a solution.
Right.
That's what my hope is.
Seek it out.
Yeah. Wherever you are, whatever you're doing today, if you are in pain, do not give up. Keep the fight. Keep going.
Right.
We would love for you to come to Synergy Healthcare and meet with Dr. Christy. And obviously, I believe you're a great resource.
Right.
But if she can't help you, there are other resources. We
Right.
have other resources. Keep searching it out until you find something that works.
Right. And the other thing is, people will come into me. The other thing that I hear is, well, I've already been adjusted by someone else and that
Right.
didn't work for me.
Right.
But with different techniques available, different people respond to different techniques. So maybe they saw a chiropractor that only used one certain technique, and we use a completely different technique
That's
that their
right.
body will respond amazingly to.
Right.
So it all just depends on, that person and that individual and what we can do for them.
Let's talk about some of those techniques.
Okay.
Because I'm like, it's PRP, PMP.
Oh, well, you're talking about joint injections.
Or we've talked a lot about stem cell therapy.
Right.
And so that stem cell therapy is available to people who need joint replacements potentially, or having joint pain. But this PRP therapy, which is my new second favorite thing. Talk a little bit about that.
We had
as I take a drink of my coffee.
That's fine. In your Green
In
Bay
my
mug.
Green Bay mug. I haven't got any hate mail yet about my Green Bay Packers cup.
We had a lot of people coming into the clinic that were kind of beyond, I don't want to say beyond our help, but we were just managing symptoms with joint pain. So they would come in, they would need a knee replacement. They had been told they needed a knee replacement. We don't do knee replacements,
Right.
So we would just try to do all we could to keep them comfortable to allow them to have more time before they had to have a knee replacement. So we were doing adjusting on, let's say, a knee, adjusting it. We were doing therapy on it. We were doing acupuncture on it. All of those things help to decrease inflammation and help the body move better. But end result was they still needed a knee
If they
replacement.
have cartilage issues, they need it. You
All
got to
that
fix
degeneration,
that. Yeah.
right.
If your cartilage is deteriorating, you need cartilage
Right. So
for
there was-
movement.
Right. So we added medical services where we could do injections. And, initially it was the hyaluronic acid injections, which is like the rooster comb, or it's a synthetic gel that we could put in the knee. A lot of people have had that. It's very common. But we noticed you have to do it again and again and again because your body reabsorbs that.
So it's not a permanent
It's not a
because your
permanent
body
fix.
will recognize it as a foreign
artificial,
substance.
right.
And it's like, we need to get this
It
out of our
breaks it
body.
down,
It breaks
right,
it down and gets it out of
out.
your body.
Exactly. So we came across regenerative medicine, which is a whole new ball game. So regenerative medicine actually will repair and regenerate the tissue that's your own tissue that's
Right.
in your knee. So the lesser of the two injections that we have is PRP. PRP, you're actually drawing blood from the person, spinning it down, and using the platelets to inject those platelets back into the joint. The platelets stimulate healing. So it's excellent for someone who has a tear,
Okay.
or who has a tendon or ligament issue, even inflammation of the tendon, and
Like
then a ligament tendinitis, or if they have a ligament tear. PRP is not necessarily for someone who has a lot of degeneration,
Okay.
but for someone who has an injury.
Okay. Like
So
an
an
old
athlete.
injury.
Or an athlete.
Okay.
Like a young person that we have a lot of young people that come in that, they start sports so young that they're throwing the ball hundreds and hundreds and hundreds of times, and they have, tendinitis, or they have a tear inside the shoulder joint or inside the knee joint. PRP works amazingly well on those young people. They're strong. They have, they have just good bodies, good repair systems.
Their
still
repair
going
systems
on.
are working great because they're youthful.
And so just injecting back in those platelets and the cytokines and the growth factors really helps those kids heal without surgery. Okay, so then the other injection that we have is amniotic allograft. This is for someone who's been told they need a knee replacement or they need a hip replacement.
Okay.
It's degenerated. There's no cartilage left. Bone on bone is what they've been told. This injection actually causes the body to reproduce cartilage in the joint. So you're growing back your good cartilage in there.
So you're hitting the heart of the problem.
Yes.
So let's explain how that works.
Okay.
Because the stem cell,
right, is in the amniotic tissue.
and it's a master cell.
It's a master cell, yeah. And when you're little, when you're a baby, you have 1 in 10,000 are stem cells. As you age, 1 in 400,000 cells are stem cells. So the injection that we use is an amniotic allograft. It uses amniotic fluid stem cells,
Okay.
along with growth factors and cytokines. The growth factors help stimulate the healing. The cytokines tell the stem cells where to go. They latch on to the cartilage that's in the knee, and they start to reproduce it. They continue to reproduce it as long as there's inflammation in the knee. So 8 months, and those are still working in your knee. So it's
reproducing cartilage.
Growing new cartilage.
Growing new cartilage that will never go away.
Right. It will never go away. People say, well, I have to have this injection again. No, it's actually producing new cartilage. And your body knows it's your own body, so it doesn't break it down, as it doesn't try to get rid of it. It doesn't, it's a
natural substance.
It's your body's
and it's live,
natural.
Let's clarify, it is live birth amniotic tissue and all that stuff.
It comes from a scheduled C-section. The mothers are screened. It goes to tissue bank. They use the amniotic fluid in the placenta, which would have been thrown away.
Right.
And instead it's donated.
From live births.
From live births,
yes.
And so
that's important for people to know.
They use that tissue to form this matrix. And this matrix then is shipped to us overnight. It's injected into the patient. It's one injection, no downtime. It's the easiest thing in the world to give somebody back their life.
It's amazing. Well, you share your story about your dad.
Yeah, my dad was bone on bone. He was supposed to have a knee replacement.
Have the surgery.
Yeah, he was going to have a knee replacement. He had went through the cortisone injections. He had went through the artificial gel injections.
Right.
He had went through therapy. He had done everything. And, you're going to have a knee replacement. My dad, super active. Like, he was starting to sit on the couch. He was starting to ice. He was starting to limit all of his activities because of his knee, and just horrible situation. And he's a busy guy. He doesn't have time for that, you know. So he came to our office. It's been 2 years now. Came in. He lives 3 hours away. So
in that small town you're from.
Yeah, in that small town. No one's doing this there. So he came in, had the one injection, went to my son's ball game that night, drove home the next day. He kept calling. I kept calling him to check on him, and he said, well, feeling pretty good. Is it going to come back?
Yeah.
Is the pain going to come back? And I'm like, no, I don't think it will. And so sure enough, 2 years later, still pain-free.
And you can show him the x-ray where the cartilage is reproduced.
Yeah.
It's there.
And on the x-ray, on the x-ray, you actually see the joint space And that space is created by cartilage. So when you have a lot of cartilage and your cartilage is healthy, you have good joint space.
Okay.
On x-ray. And so then if you are bone on bone, you know, and you have terrible joint space, that just shows that the cartilage isn't there to create that space. So that's how we can monitor, oh yeah, you know, it's growing. There's space there. There didn't used to be space there. So we're getting some new growth.
That's what I love. You're really, I mean, I would trust you because look at this sweetness.
I know.
How could you not trust her? I would trust you. But for those that might be a little skeptical, you cannot argue with the x-ray. You can see it right there.
You can see the
and if you're feeling better and you're pain-free and you don't have to have a surgery.
Right.
And I'm amazed at people who will still choose to have surgery over looking at other options.
That's because they haven't watched it on YouTube yet.
Or maybe they don't know that 1 in 400, is that the statistics?
Yeah.
1 in 400 people die from
after having a knee replacement.
Replacement.
Whether it's from the complications or blood clot or, you know, allergic reaction or infection.
Yeah.
1
and
in
we're
400.
not now listen. There are times that some things have to be done. We're not knocking it. Sometimes it has to be done, and if it has to be done, it has to be done.
Right.
But what we're saying is, make sure you've gotten second opinions. Make sure you've looked at every option. That's what we want.
Yeah.
And if you're sitting, and then there's the people that say, I'm not having surgery.
Yes.
Right?
Oh yeah.
That
we have that a lot.
My mother.
Yeah.
If that were to ever happen, she doesn't like going to the doctors, and she would just die of pain.
Sure.
She had a broke arm one time, and she fell out of her bed, and and I was like, Mom, are you okay? Mom, are you okay? And you know,
I'm fine.
It's hurting, but I'm fine. And then like 2 weeks later, she calls me. She goes, well, baby, I guess I'm going to have to go have it looked at because I can't even sleep at night.
Oh, no.
I said, are you serious? She goes, yeah, it's really hurting bad. We go to the orthopedic surgeon, and her broken bone was already starting to heal back crooked.
Oh, no.
I'm like, so anyway, just a little side story.
Yeah, don't wait.
If you're like my mother,
don't wait.
And you've got enough pain tolerance to walk around with a broken arm for 2 weeks because you're so afraid to go to the doctor, there's some option for you that doesn't require surgery. Right. So there's the opposite effect to that too. There's the people who think that surgery is the only option, and they're going to do that. And then there's those who think, I will never have surgery no matter how much pain I'm in.
Right, and this gives them an option.
And this gives you an option. It's great.
It is great.
And
we have so many people, you know, you're saying like some people might be on the fence. We have so many patients who have offered to talk to people who are on the fence. I mean, it
like
just
success stories.
Yes, they've had it done, and they're like, I'll talk to whoever about it because it's been so wonderful.
Because now they're successful and they want to share that. Isn't that
great.
The way it goes?
Yeah.
Like when you find something awesome, you want to tell everybody.
Oh yeah.
You're like, you got to try this. You got to try this. This is so awesome. It's
yeah.
so awesome.
So sometimes I do have patients that are like, I don't know.
We need to bring a success story on sometime. Yes.
Let's do that.
Everybody loves success stories.
Yeah.
So maybe be thinking about who you could bring on in the next month or two on the show for a success story. So, hey,
love it.
If you've really been intrigued by what Dr. Christy and I have been talking about today, you might think about coming in for a free consultation. Yes, free.
Yes,
you do a free consultation with anyone who would like to get some information.
Oh, yeah.
So how do they contact you?
They can just call the office at Synergy Physical Medicine. The number's 309-688-4484. And I'm there every day but Tuesday. So you can always schedule a free consultation, come in, have a conversation with me, and see if what we do could help you.
Yeah, there is no reason for you to live in pain. Don't give up looking for a solution. I guess that's the point. You know, it's like there's a lot of causes of pain out there, but don't give up looking for a solution. And I feel like sometimes, don't you think some people may have given up, that they're just like, well, this is just the way it's going to be.
It. Yeah.
I'm just doomed to be,
right.
You know, it's kind of like being overweight. I see that a lot with women that come into curves. They're like, this is just how it's going to be. And it's like, no, you can't, you know, you don't give up. You can do it.
Right.
You can do it. So, all right. Well, listen, guys, our half hour's up. I can't believe it. Thank you so much for tuning in. We really appreciate your support. Remember, share, comment, like, ask questions. We'll come back and answer later. Tune in every Wednesday morning around 8:30. We sometimes get a late start, but somewhere around 8:30 for Healthy You, and learn some ways that you can live a healthier lifestyle that makes it a little easier, I think. Dr. Christy, thank you so much.
Thank you, Kim,
for being with us today, and enjoy the rest of your Wednesday. So, I know.
PeoriaLife.com